Hey guys, I'm Wendy. I'm one of the nurses that works in 3T Prep and Recovery. If you don't know who we are the pre-op and post-op area for the cardiac cath lab, the electrophysiology lab, and the cardiovascular OR here at Emory University Hospital. Our clinical nurse specialist, Brandy, asked me to do just a little bit of education about something you may have seen or you might see in the future, and that relates to sutures that are held in place with a stopcock instead of a traditional knot. It's something that we see in our electrophysiology patients, specifically those that have had ablations, because during an ablation, the doctor tends to use a fairly large sheath in the femoral vein. And as we know, the bigger the sheath, the higher the risk of bleeding. And that would be bleeding from both the vein and the skin in the post-procedure period. So because the sheaths are so large, the doctors do tend to use a closure device in the vein, such as a perclose, or they might manually hemostase it. And then because of the risk for bleeding around the skin, the doctor will often use a traditional figure of 8 suture and suture the skin while the patient is on bed rest. And then usually just at the end of the bed rest, the doctor or the fellow will come and remove that suture, whether that's here on 3T or maybe the morning after if the patient is on 4B or 4G. So something that has started recently, and this is physician preference, so you won't see it on all of the patients. You might see it rarely or you might never see it. But something that we're starting to see is instead of using a knot to tie the suture in place to the skin, the doctors are using a stopcock to hold the suture in place in the skin, and that's a 3-way stopcock. So traditionally, they'll put something like a figure of 8 suture in the skin. This kind of bunches up the skin, holds it together, like I said, while the patient's on bed rest, so that they won't have any bleeding from the skin. And then at the almost the very end of bed rest, the doctor will come remove that suture using a pair of suture scissors, and then hope it doesn't bleed. Once you remove a suture that has a traditional knot in it, you've already committed. So if it's gonna bleed, you have to hold manual pressure, and you're gonna be at the bedside for quite some time, maybe 10 minutes, 15 minutes, maybe just a couple of minutes. But once that suture is out, if you have bleeding, you're using your hands to stop the bleeding. With the new stopcock technique, you basically have a figure of 8 suture, and then the doctor slips a little stopcock on it. You turn that stopcock to the off position, and that's what holds the suture in place. So I'm gonna demonstrate that on a pillow because I didn't want to have my camera all up in a patient's groin. And I'm gonna show you a little bit about how to do it, why we do it, and answer any questions that you might have. So let's get to our patient. Okay, so this is our patient. This is just a simulation. This is supposed to be the patient's groin and the patient's skin. So you can see that we have a suture in place here, and right at the skin there is a 3-way stopcock, and then the tail of the suture is coming out here. I'm going to try to zoom in a little bit so you can see exactly what it looks like up close. I am an amateur videographer, but you see our 3-way stopcock. Looks just like this. So the suture tail is coming in here. It's threaded horizontally through here, coming out here. And because we have the stopcock in the off position, about 45 degrees right here, this stopcock is not going anywhere. It's holding the suture nice and tight and bunching the skin up. So all you have to do to remove this is put the stopcock in the most neutral position, begin to slide it off, unbunch the skin, and you're either going to see bleeding or you're not. If you see bleeding, you just thread this puppy back on, again, put it in the off position, and let them stay on bed rest for another hour, hour and a half. You can kind of use your discretion, or just go ahead and call the doctor or the resident or the fellow or whoever's covering, and they can tell you how long the patient should remain on bed rest. Now, if you don't see any bleeding, you'll have taken it off, unbunched the skin. This is our figure of 8 suture. You feel good, you've committed, you don't think the patient's gonna bleed. You take this all the way off, and then you just pull this suture out all the way, throw a gauze and tegaderm on there, and you are done. Hopefully that demonstration was fairly easy to see and easy to understand. It's actually a pretty simple procedure and a little bit easier than pulling out a traditional suture because, again, you always have the option of pushing that stopcock right back on to stop the bleeding and continue the patient's bed rest. So as of today, and it is April 22nd, Dr. Lloyd from the EP department has stated that this is a nurse-driven protocol. He has gotten together with Dr. Westerman and Dr. Shaw, who are our other EP attendings, and they have agreed that the nurses will do this, whether that's in prep and recovery or on the floor. It should be part of the ablation post-procedure order set, so you will hopefully see the order that says to go ahead and remove the suture at the end of the patient's bed rest. That actually goes for sutures that have a stopcock and sutures that are traditionally knotted in place, but more to come on that later. Now you know how to do it. If you have any questions, just go ahead and call us over on 3T at 404-712-7950. Now, if you don't see it in your post-procedure order set, it could mean one of two things. It could mean, one, that the doctor himself or herself does want to pull that suture, or two, it could mean that they just forgot to check that particular order within the order set. So if you don't see the order, it is okay to question it. That's about it. Hopefully you learned something in this video, and reach out to us if you have any questions. 404-712-7950 is the nurse's station number here on 3T Prep and Recovery. Thanks.